away for myself.
Okay. So we then need to go over kind of the public comment rules before we
Yeah,
go live.
so we're still at 5:57. I got a timer up there. We had a couple minutes.
What's the running number of folks that we have right now to speak?
We have 20.
Alrighty.
And I don't quite see 20 in the meeting that were guests from the public comment list. So however you want me to handle that, Lori, I'm happy to come back to them if they pop in later, as long as we're in that public comment section, but they did all know that we were doing it at the beginning. Yeah, and this is why we do the waiting room. I think some people were sharing the Zoom link because now I have another teacher showing up who isn't on the public comment list.
Yeah. So say your announcement again. I mean, this is, if you're inside the Zoom, this is for board members and individuals who want to make public comment. If you want to watch the board meeting tonight, you'll go to the YouTube link that we have as well. So if you're here for public comment, you need to make sure that you're filling out the form and we have your name. We have roughly 20 people who've done that, and we will just go down the list. But there will be a 3-minute maximum. At 2 minutes, you will get a yellow card by Diana Hagland, our communications officer. And then at 30 seconds, Ron Brown, our director of technology, will chime in and say you have 30 seconds to go. At 3 minutes, and we're going to have a hard 3 minutes, Ron will stop you. Thank you for your comments. If you have additional comments that you were not able to make, he will encourage you to send those to the board. Because we have so many people, we really want to make sure that we're giving each person their 3 minutes or less. You don't need to speak the whole 3 minutes. But we really want to be respectful for everybody's time and being consistent with everybody's time. Ron, anything you would add?
I think that is the crux of everything we need to address with anybody popping in who's not used to a Zoom. We do ask, if you are making a public comment, you will want to turn your camera on, because that's the only way you will show up within the live stream that we're broadcasting publicly. So your audio and your camera can be on, and you have your 3 minutes, and Paul gave you the rules on the timer piece. So we will do our best to facilitate as best we can in the virtual meeting. This is the first one we're taking Zoom commenting online. So yes, we're going to do our best. So you're until I call your name, you're welcome to leave all cameras off except our board members. And then when you hear your name, we want you to say your full name and make your comment. And Diana Hagland, you will see her hold up old school pieces of paper in front of the camera with the colors of the green, yellow, and red indicating your time, just so you know. And I will chime in at 30 seconds to give you a verbal cue when we start that. Okay, so I am going to unshare real quick, and we should be back to, there we go.
Okay.
So
and I'm showing 6:01 on my official clock here. So I'm going to call the special meeting of July 29th of the Wenatchee School Board to order. And welcome everybody. This is the most guests we've ever had on our Zoom meeting. So I want to thank you for joining us this evening. Tonight we're here to talk about a very important topic during this pandemic crisis that we're experiencing internationally. This is having a huge impact on our families, our whole community really, but our families and our students. And the board and the district wants to take a really thoughtful approach to how we address this successfully for the most, well, really for all students going forward. With that said, we will start the meeting with public comment. I know that several.
We're going to start with Dr. Johnson.
Beg your pardon, Paul?
We're going to start with Dr. Johnson and Dr. Rutherford.
Oh, okay. That would not. I was hoping that was the case, but they are not on the agenda. So thank you to Dr. Johnson from Confluence Health. He is our infectious disease specialist, and is Dr. Peter Rutherford also Rutgerford. I see we have Dr. Rutgerford, or otherwise known as Dr. Rutherford, joining us today. And we have invited these two gentlemen to share their perspective on the community situation, I guess it is, with COVID, and give us some insight as to their thoughts on how the district might think about proceeding with the reintroduction of learning for our students. So I'm not sure which of you wants to kick it off, but you're both muted. So whichever it is, you need to unmute yourselves. Not turn off your video, Pete.
Yeah, I believe Dr. Johnson will start.
Hello, can everyone hear me okay?
Yes, I think so.
Great. My name is Mark Johnson. I'm an infectious disease doctor at Confluence Health, and I've been here at Wenatchee Valley for the last 2.5 years after I left active duty service as a U.S. naval physician. My job is as a infectious disease doctor is to take care of patients with infectious diseases. And so I take care of all the critically ill COVID patients admitted to our hospital. And there are a couple of things that we know for sure about this virus, so we keep learning more about it. There are some things we think we know fairly well, and then there's some other things that we are still learning about. And so we know that this virus can cause severe and potentially fatal disease in certain individuals who get it. And part of what makes this virus so insidious is that 45% of infections are asymptomatic. And that is why this virus is able to transmit so readily. And we have recently come to learn that children between the ages of 10 and 19 seem to transmit the virus just as effectively as adults do. And it appears that children under the age of 10 transmit the virus about half as effectively as adults. And so that risk has been mitigated up until this time by not having children in school. But obviously, once individuals who potentially can be infected or are asymptomatically infected get into close congregate quarters for extended periods of time, there is a real potential for significant increase in cases, especially as our public health experts tell us our current case counts at this time are about 9 times where they're supposed to be for where we're supposed to be at for safe start for going back to school. And so I appreciate that all of you are having to make difficult decisions about how to keep school children and teachers and staff as safe as possible. Because there is, at this time with a lot of community transmission of infections, a real risk of, at this moment, a reservoir within school children in congregate settings leading to significant transmission of infection. We're still learning a lot about this virus. We learn about it every day. It's hard work. We have a lot of really sick patients here in our hospital. And thank goodness there's a lot of people who get this virus who have mild symptoms, but it's incredibly difficult to predict who's going to have mild symptoms. And it's also difficult to predict who's going to be one of those super spreaders. And so the unpredictability of this virus and the way it transmits puts us all in a difficult situation as we think about how to maintain our current healthcare resources. And, you know, at this point in our hospital, we are pretty full. not just with COVID patients, but patients with other infectious diseases or even patients who don't have infections. And so I appreciate that this is a complicated situation. I also appreciate that, like me, you're probably incredibly frustrated by it as well. So I think those are the big points I wanted to make. Am I supposed to be available for questions as well, or should I turn it over to Dr. Rutherford now to make some comments?
Let's turn it over to Dr. Rutherford, see if he has any comments to add. But then, yeah, I would ask the board if they have 1 or 2 questions, because the other thing, Dr. Johnson is actually working in the ICU this evening, and he was gracious enough to give us some of his time. So I appreciate it. But Dr. Rutherford?
Can you hear me okay?
Yes.
Yes.
So I guess I would just make a couple of comments around data. And the Chelan and Douglas counties and really all of North Central Washington, we were at a relative nadir of this disease until about the middle of June. And we have seen a progressive increase in the disease, and I'll go back over that in a minute, really up until the last week. And things may have plateaued a bit in the community testing at this point. But as an example, compared with the middle of June, the number of tests that we are doing per day has gone up by about double, maybe double and a half. So we are testing here in the Wenatchee area now between 200 and 300 people a day. Some of those are pre-procedure testing and are so not as far as the community is involved in the disease, but it's probably 200 or so that are calling with symptoms or concerns or contacts with people with the disease. In the middle of June, the percentage of people that were positive for this disease in our testing was in the 3 to 4% range. It is currently running somewhere between, depending on the day, between about 12 and 15%, and on other days, maybe even higher. The other thing, as Dr. Johnson alluded to, is the hospitalizations are a lagging indicator in that you get sick, or you get exposed today, you get sick 5 to 7 days from now, you get hospitalized, it's somewhere between the 7th and 10th day of the illness usually. So it's a couple weeks after your exposure, and as I said, a week to 10 days after you become symptomatic. And we have seen a progressive increase in hospitalizations over the last 3 to 4 weeks. So it fits again timing-wise with this increase in disease that we saw fits in the middle of June. And our hospitalization numbers are not yet decreasing. They are progressively increasing and are reaching the point where we are not able to provide the healthcare services for patients with COVID for everyone in this region, as has been our goal. We are now on a diversion status and are sending people to other places in the state. We were sending them to other hospitals in Eastern Washington, but most of them are now full, and so patients are having to go to Western Washington for hospital care. I think at this point, I agree with the points that Dr. Johnson made, and I do worry about anything that will increase the spread of the disease in this community at this time. I think should the disease prevalence or burden, whatever word you want to use, begin to decrease, then it is certainly most appropriate to look at then the opportunity to do a different mechanism of teaching than in-person school, the in-person school day. And that would be my comments.
Thank you. Appreciate that.
Yeah, thank you so much. Dr. Johnson, when you think about, because there's been a lot written around those 10 and younger why shouldn't we bring 10 and younger? And Dr. Rutherford, why shouldn't we bring the 10 and younger in as from your medical expertise?
Well, so as I mentioned, kids 10 and younger are not immune from infection. And although it does appear that severe disease in children is uncommon, it's not unheard of. And so we are still learning about that, that there is a potential in areas where there's a lot of active transmission of the virus in the community. There's a potential for severe, potentially fatal disease in kids as it stands. But because children can still transmit this virus, and because I have a 7-year-old and I'd love for him to go back to school now. But at the same time, there's that concern that kids don't do the best job oftentimes in that age group of keeping their hands away from their mouth or their nose or their eyes. And in close settings, if there's a lot of transmission in the community, it's likely that some of these children, if not many of these children, might have asymptomatic infection, bring it into the schools, potentially infect their teachers or other school staff, infect other children who might be asymptomatic and bring it home and then infect their family. And so even if we see very low rates of severe disease in children, which we are seeing, then there's still a potentially significant risk of mom, dad, grandparents, other family members in the home getting infected and having severe disease and ending up in the hospital. And so that risk remains a real risk. That risk goes down quite a bit when you're in a place where community transmission is a lot less. And I appreciate that we're never going to mitigate risk entirely here. But being able to get kids back to school safely at a time when active transmission of the virus in the community is a lot lower than it is now would markedly decrease the risk of that ongoing secondary transmission of kids bringing infection home with them and potentially significantly increasing infection in the community.
Thank you, sir. Dr. Rutherford, would you add anything else?
No, I think Mark covered it just fine.
Okay. Then board members, being sensitive.
I'd like to ask a clarifying question to that. We're currently somewhere around 9 times the number of cases that we need to have for a state safe start. And you said that you'd want us to be significantly lower than that. The state previously suggested 25 per 100,000. Do you have a number in mind where you would feel comfortable, a ratio? You said a lot lower, but what does that mean?
And honestly, that's a decision that I know gets made by the public health folks. And so I wouldn't want to tread on their expertise, but getting much closer to that level that the state is recommending. That's based on input from epidemiologists at the state and the national level. And that would be a reflection of better control of the virus in our community by increased masking and decreased transmission. And we might see those levels decreased over the next month or so to levels that are much lower than where they need to be at. But I don't have anything different than what those numbers that you quoted. But again, that's a decision that kind of falls with our public health experts.
Okay. And just one other clarifying thing with that. So if we dipped for one day into 25 per 100,000, is that enough? What time period would we need to be in that range in order to feel confident moving forward?
Some of it depends on the trend instead of one single data point.
Okay, gotcha.
But you're right that if we're seeing a trend where we're getting into the right area and we're seeing our cases keep going down, and they get into that right range, then I think we're at the point where then it's time. The cases aren't going to exponentially drop over the course of 2 weeks, but if we're seeing significant sustained drop and we get down to that right level, then we might be prepared, because that would reflect that in the community we're doing the right things to minimize risk of transmission.
Dr. Johnson, may I ask a definitional question about that statistic of 25 versus over 400? I cannot relate it to the weekly cases on the State Department of Health Excel spreadsheet. Presumably that's so many cases within a time period, but I don't know what the time period is. It doesn't appear to be a week.
And again, as an infectious disease doctor, my job is to take care of the individual patient. So please don't hold me to this, but it is my understanding that they have been basing that on over a 2-week time period as a rolling average.
Okay, a rolling average might explain a lot. Okay, 2 weeks.
But if someone knows that better than me, please don't hesitate to jump in.
No, that's fine. It was very confusing, and it makes it easier for us to follow what's going on while we wait and listen. Thank you.
Thank you.
This is Pete Rutherford. I would agree with the 2 weeks. Part of the dilemma is where the source of the data is coming from. And there is significant differences in the timing and the start and end dates of all of these things, which does make the interpretation somewhat difficult.
Other questions by other board members?
Yeah, Pete, you talked about us being on a diversion status, and there are numbers being reported daily in the Wenatchee world that are coming from Central Washington Hospital regarding hospitalizations. So we've seen those numbers, edging up a little bit. The numbers that were reported last night talk about 26 patients, 6 in the ICU and 6 on ventilators. So are you saying that with this diversion in place, that our hospitalization rate is actually higher than that?
So Mark might correct me, but I believe as of today, we have 10 patients in the ICU, 10 patients in the ICU who are COVID positive, and all 10 are on ventilators. And then we have another 16 or so on the medical floor. The way we have organized the cohorting for these patients is such that from a staffing perspective, that is about our capacity without shutting down significant parts of other parts of our care in the organization. And so the approach that the hospitals in the state have taken is that when a hospital reaches that level of capacity where we need to significantly curtail other healthcare activities, then we are trying to send those patients who would need admission from there to other hospitals that are not at that same level of capacity. And that's what we call diversion, is that we would send people somewhere else and divert from admitting them to our facility.
Sure. So I'm just...
And I will say that there were 3 of those last night.
So we don't really know what the total number of North Central Washington residents who are hospitalized for COVID is, with those that are hospitalized locally plus those that have been hospitalized elsewhere. Is that right?
I know that at this moment, there are, as of this morning anyway, about 4 patients at Samaritan Hospital in Moses Lake. There are 3 or so, maybe 4 at Mid-Valley Hospital in Omak, and then the 3 that were diverted from here last evening.
Okay, thank you.
Other board members?
This is just a comment. I want to thank Dr. Johnson and Dr. Rutherford for giving us kind of this complete picture of what not just healthcare is looking like in our immediate healthcare system, but how it's impacting the healthcare system as we have to divert patients out. I think I would agree, it sounds worrisome that if we are gone from 6 ICU patients up to 10 who are all COVID-19 positive, who are on ventilators, and we can't accept anymore, and people are still showing up, that is quite worrisome. So I really appreciate not just all of our staff at the hospitals and clinics that are doing work with all our patients, but in particular, I know our ICU staff, including you, Dr. Johnson, and all the nurses. I know that can be quite taxing and weary on one's own personal conditions. So I just want to thank you and the rest of the staff for all that you're doing in our community. And I think our schools are one way to help you guys hopefully not continue that transmission. So I appreciate all the feedback you have given to our district staff to make those decisions and to inform us tonight. Thank you.
Thank you.
I agree.
Thank you.
Any other board members have anything to add? Appreciate the time that you two gentlemen took to spend with us this evening. I know you have lots of really important things to do, and it's very meaningful that you were able to speak to us and those who are out there listening as well. You have an important message to bring, so thank you so much. And you're welcome to stay and listen, and it's a lot of fun here. So feel free if you like, but you're also free to leave and get on to your important work. So whichever you like. We will move on with our agenda at this time. Thank you so much, gentlemen. And
Thank you.
I believe we are transitioning straight into public comment. And Ron, are you facilitating that for us? I believe you have a list.
Yes, yes, I am. This is our first attempt at public comment, so I think it'll go fine. We did have a few public comments submitted that did not show up to the meeting virtually. So whether that's technical difficulty or other reasons, please just communicate back with us if you didn't get a chance tonight, so we can make sure we help you prior to our next meeting, so we can get that and or get it in writing so you can get that to the board.
Could they communicate with you in real time, Ron, if they're out there trying to get on?
That would be too hard at the moment, Laura, to try to facilitate that along with facilitating the rest of the meeting.
Got it. Thank you.
So I'm going to go in the order in which they popped into our form. And so that's fairly random. And I think I got everybody who is in the meeting tonight with us. So as we talked about earlier, I'd ask you to turn your camera on, unmute yourself when I call your name, you can state your full name and your position or your role in the community. And then do your public comment. You'll have 3 minutes. Diana Haglund is going to hold up some old school green, yellow, and red. We don't have a way to digitally time with the cameras going. So you're going to get a 3 minute, a 2 minute, a 1 minute warning. And then about 30 seconds left, I'll pop in there and just let you know that you have, that's about the time you have. We do not want to cut you off. So if you could wrap it up at that point, so we don't have to mute you, because we have a lot of people wanting to make comments tonight. And I will turn my camera off as to not be distracting in terms of the stream, and call the name. And the first one up for public comment that I see is Monica Christensen.
All right. So I'm Monica Christensen. I am the current Wenatchee Education Association president. So members of the school board, I am speaking on behalf of the Wenatchee Education Association. We represent our certificated teachers, the ones who would be on the front lines if we were to go back into the classrooms face-to-face in August. Our #1 priority as an association is to protect the health and well-being of our members, their families, our students, and the community. And if we go back face-to-face, we are placing our entire educational community at risk. All of our educators and students want to be back in the classroom, but the WNEA and the district have agreed. We are not willing to put anyone in our community at risk just to get back to normal. We are saddened that we will not be returning face-to-face, but our members are grateful for the decision that Dr. Gordon has made. Knowing our health and safety and that of our students and families is their #1 priority. We know this decision did not come lightly. For weeks, Dr. Gordon has been meeting regularly with our superintendents throughout the North Central ESD. They've been working in conjunction with multiple health organizations and health professionals, all whom are stressing the importance of not returning in person. And they've been working closely with the state superintendent of instruction. Unfortunately, confirmed cases of COVID-19 are increasing, not declining. And we believe a move to face-to-face instruction at this time would ensure a rise in cases, causing our schools to shut down in a matter of weeks. So, Wenatchee School Board, when you choose to adopt Dr. Gordon's recommendation, be confident. This decision was made with careful thought, factual information, and with the health and safety of the entire community in mind. Be confident that we, the educators, can take on the task of educating our students in a manner that will promote their learning and our skills to higher levels. We will come out of this stronger, a stronger academic community, educators and students alike. Be confident that we will be back in our classrooms with our students as soon as it is deemed safe for all. Again, even as we return to normal and you hear, see, there was no reason we had to close schools. We could have been in them all along. Because unfortunately, I believe you will hear those words, but be confident that there was a reason you made this decision. We are the reason. Look out at your community and know they are the reason for this decision, and we thank you. Getting back into the classroom safely is our goal, but in order to get there, our community has to help. Please mask up, wash up, and social distance. The sooner the numbers drop, the sooner we can be where we need to be, in the classroom with our students. Thank you for supporting this decision to go online.
Thank you,
Thank you,
Monica.
Monica.
You are welcome.
It was like 3:05. I couldn't cut you off, but it was right on the money.
Thanks, Ron.
Next up, and I already gave her a heads up, Megan Carter.
Hi, my name is Megan Carter. I am an audiologist at Confluence Health. I am not jealous of any of you for making this decision. This is going to be hard and tough. I'm speaking on behalf of all of my pediatric patients. I have lots of them that are in the Wenatchee School District who have hearing loss. A lot of them wear hearing aids, and I heard from some of them and their parents while we were doing this in the spring that they had difficulty doing school online. So I just want to bring that up so that everyone is aware. I know we have a lot more time to prepare this time around, but use of captioning and written materials for kids with hearing loss is super important. I just want to make sure that they don't fall behind. I know this is probably kids with hearing loss amongst all kids with disabilities is a lot to handle, a lot to think about how we transition them into virtual learning. But just wanted to be an advocate for my patients. And if you have any questions or recommendations or anything, please feel free to reach out to me.
Thank you, Megan.
Thank you, Megan. So next up, Chelsea Mahuika. Hopefully I got that right.
Okay. I was supposed to go fourth, so I wasn't quite ready yet, but thank you. Hello, I appreciate all of the effort that is going into educating our children at this unprecedented time. I understand you have many challenges you are facing. I was very disappointed to learn that we would not have the option for in-person instruction this fall. I wanted to provide my insight as a mother of 6 children, 4 of which are school age. Our experience this spring was not a positive one, and much of that was related to the amount of time that was expected of my children to be online and the lack of direction and interaction that we received. It created many emotions in all of us that I do not wish to relive with continuing instruction 2.0. My children thrive at school, love their teachers, and excel in the classroom. This was not the case once schools shut down. During the spring, all of my children lost all motivation to do schoolwork. I'm not sure I can recall a school day between March 12th and June 19th where someone was not crying or frustrated. I am asking that the school district could provide a hybrid option for those of us that wish to keep our children enrolled in regular school and interacting with their teachers, but with an option to provide instruction and classwork that is not all virtual, something that is student and family driven and teacher directed. If I wanted my child to log on for some of those core classes that are needed, then allow that to happen. If I want to provide PE, reading, music, and art in a home setting, then allow that to happen. We're being flexible with you, so please be flexible with us. I would love to have benchmarks and expectations for my children to meet each quarter so that I can ensure that they're getting what they need and are staying in line with their peers. High support and oversight with families would be critical in this model, while still allowing families the flexibility needed for their children. Asking students to log in from 7:45 to 2:30 every day is not going to work for my family or any other family that I know. I do not want to look outside of the Wenatchee School District for other options to educate my children, but I will have to if we don't have more options given by the district. I have spoken to many families in the last few days, and I have not heard one family that is okay with their children being online from 7:45 till 2:30 in the afternoon. So I strongly encourage you to look at other options. Thank you.
Thank you, Chelsea.
Thank you. Next up, Emma Philly.
It won't let me do it.
It won't let you turn your camera on? Well, we can hear you. So you are on the stream through audio. If your camera's not working, you will still show up.
It says you cannot start your video because the host has disabled it.
Let me see if I can kickstart it. And if not, we can hear you anyway, and you're welcome to begin. Let's give it about 10 seconds. And there it goes.
Hi, my name is Emma, and I'm a registered nurse at the hospital. I personally have seen the ebb and flow of coronavirus in our community. I talk to people every day that have been tested and that are positive. They live in multi-generational homes. They're going to birthday parties. They're at Safeway. I wanted to speak to you today because I have a 6-year-old who is going into 1st grade. This year, he will learn how to read and write. The CDC did a study of all the coronavirus cases from February, March, and April. Of the 149,000 cases, 1.7 of them were 18 and under. I understand the responsibility of the school board to protect teachers and staff as well. I've heard that the school district and even individual teachers will be held liable in court if an illness occurred from the coronavirus and the transmission occurred at the school. This can be resolved with a simple waiver. I understand the risks of sending my child to school, and I do not hold you liable. I understand, 2 recent surveys estimated that only 60% of students were regularly attending distance learning. You guys have a duty to choose what is best for the community and for the children like my son who need a classroom setting. They need specialized services, counseling, social services, subsidized food. Online learning is not enough. This is not about the coronavirus. The cases are going to rise and fall. It is in our community, it is all around us, and it is not going away. The CDC website, I'm going to quote it. It says, "It is important to consider community transmission as a risk as schools reopen. Evidence from schools internationally suggests that schools reopening are safe in communities with low COVID transmission rates." And that's us. I just ask that you weigh the cost of this decision and do not punish our children out of fear. Thank you.
Thank you, Emma.
Thank you. Next up is Adam McDonald.
Hi there.
Hey, Adam.
Hi. Ready, Ron?
Yep, we're good.
Okay. So hi, my name is Adam McDonald, and I am a history teacher at Wenatchee High School. Hello to all of you. I haven't seen you in person in a while, so good to see your faces again. I wanted to come before you today as two roles, actually three roles that I share. I'm the union treasurer. I am also a high school history teacher, and I'm also a parent of an amazing 7-year-old who's going into 2nd grade and is super excited about it at John Newberry. I want to thank you for making the difficult but necessary decision, and really the only choice that you can make at this point with the transmission and the situation we find ourselves in, of moving us to an online only system at this point. I'll give you just a little bit about myself since I can't speak for everyone in general, but as a teacher, I'm looking forward to, I'm teaching a new class this year that I've never taught before. I'm very excited about it, AP Human Geography, very excited to teach that. I've been wanting to teach it for a while. And I would love to be sitting in a room with my students, having those awesome discussions, seeing as those lights click on in their eyes. But I also want to make sure that my students are safe, because that's the most important thing to me. And I want to make sure that their families are safe and that their loved ones are safe. Simply put, we're just not in a place, as our medical professionals pointed out earlier, where this makes sense as a community. We just simply are not there. There's a lot of factors that come into play in this, and we just simply are not in that place. A great example of this is Georgia Tech University released a tool that's available widely online, where they calculate based on the transmission rates in a local area what the risk is given a group size. And what they do is they update based on the county you're in, what is the risk in a given group size that there's someone who is COVID positive. And currently, I've been watching steadily as Chelan counties has creeped up. Currently, we stand that if you have a group of 100 people, there's a 99% or greater chance that one person is COVID positive. You all are very well aware that our schools are much more than 100 students. And so if we were to have this happen, the odds of someone being COVID positive coming to school and spreading that are nearly a perfect 100. Additionally, the thing that I'd like to emphasize as well is we talk often about deaths from COVID, but COVID is not only often resulting in death, but also can have other consequences as well. Many people can have potential lifelong consequences and health impacts. And I don't want to see that going home to any of my parents, any of my students, any of my family as well. And we cannot just risk this to our educational community. You all know the devastation that we feel when we lose a teacher or a student in this district. And I don't want to normalize tragedy where we start to see people happen over and over again, where we start to become immune to the idea of yet another person falling prey to this. And while I know this decision is difficult and it affects our community profoundly, thank you for making this difficult decision to keep our community safe, all the way up and down from the top of the admin, all the way down to the lowliest student. Thank you so much, and thank you for your decision.
Thank you, Adam.
Thank you, Adam. Next up, Lorna Rose Hahn.
Oh, Ron, you stopped my video.
Oh, let me, there we go. See if that works.
All right. Can everybody see my face?
We're good. We can hear you great. So
all right.
You're on when you're ready.
So I'd like to thank Megan earlier for speaking about students with disabilities. I'd like to tag on to that as well. My name is Lorna Rose Hahn. I am a parent of two, a 5-year-old who just graduated her IEP this spring after almost 2 years, and a 7-year-old who recently received a diagnosis and will be likely needing a 504 plan at some point in his career. First, I want to express my sympathy for educators, administrators, and the school board for being in this difficult situation. My concerns are about online school in the fall. For my full opinion, please see my editorial regarding special needs kids published in Wenatchee World on July 4. I stand by that editorial 100%. The takeaway from that editorial are these: that we have upended our lives for this virus, which we really know little about. What we do know is that it's a lot less deadly than originally thought. What we do know is that child abuse, suicide, including among children, and drug use are up. What we do know is that kids with special needs are not getting their needs met. What we do know is that kids learn best in person. I am devastated for children in abusive homes who are being told to stay home for school. I am devastated for parents who don't have the privilege of staying home while their child learns. Parents should be given the choice of in-person classes. This pandemic has highlighted things that have long needed to happen: smaller class sizes and better teacher pay. We cannot measure the health of a community simply by number of infections. There seems to be an obsession about numbers of cases. There is so much more to the health of a community, and schools have a lot to do with that. They provide so much more than curriculum, and I hope we are finally recognizing that. There is so much collateral damage being done to our kids right now. So let's stop the hemorrhaging and at least offer the choice of in-person classes. Thank you.
Thank you, Anna.
Thank you.
Thank you very much. Next up, Karina Vegavilla.
Hi, I'm Karina Vegavilla. I'm an administrator and faculty at Wenatchee Valley College. I'm a community leader, a parent of 2, and a former board member. I'm here to speak for the needs that Lewis and Clark Elementary School has. We are the only dual language school in the Wenatchee School District, and we as parents believe in the dual language program and want to ask the school board to listen to our concerns and our proposals to continue to ensure that all students succeed at high academic level, are biliterate, and college and career ready. We love our teachers and staff. Parents and students will miss seeing them during drop-off and pick-up, school activities, and parent-teacher conferences, but we understand the district needs to prioritize the safety and health of all, and we are thankful for that. Our school enrolls 44% of English language learners, almost double the average number of ELL, to support the students and parents in monolingual households succeed as the district moves to teaching and learning fully online starting in the fall. To avoid losing language skills in both English and Spanish, it would be beneficial to create and sustain small learning groups, language buddies who can meet online and safely face-to-face will ensure that native English speakers and native Spanish speakers maximize their learning. Or parents working essential jobs. State Superintendent Chris Reichel has said that nothing prevents a school district from providing childcare for anyone in the food supply chain. As a Title I school, we would like to request the school board to consider opening childcare for students whose parents are food supply workers. We would like to see the district offer tech classes for Spanish-speaking parents and their students. Many of our parents are new to technology and would benefit from learning about online tools along with their students. A culturally sensitive approach would be to have small groups that could meet face-to-face while following physical distancing and masking requirements. The dual language program is unique and we recognize it presents challenges that may not apply to other schools, but we're here to help. We want to thank Superintendent Paul Gordon and his cabinet, all the school staff, teachers, and the board for all the work that you've been doing behind the scenes to get ready to start the new school year. And parents are here to support the school and our students. Thank you.
Thank you, Karina.
And I'm thinking it's our last one. So speak up after this one if you're still in there, or chat with me. I think I am tracking the names. Josh Philly.
Hey guys, I'm Josh Philly. I work at Confluence Health along with my wife who spoke earlier. And so I just want to thank all of you for what you're doing. and for your positions is so huge in our community for supporting our children, and just in the middle of all this chaos, bringing some structure and some guidance into our little ones. I have a 3-year-old and an almost 7-year-old. My son will be starting first grade this fall, and he, was home from March until June, and he's been in, there's been YMCA childcare that he's been a part of this entire time. And I just want to make a couple points. We have on Facebook, we have NCW Parents page, so I just encourage anybody watching to go to that page and like it and get involved. We have different Eastmont groups and Wenatchee School District groups. So we just want to be connected with you as a community and petition for our children, petition for safe learning, but also there's nothing like a teacher coming side a student's desk and looking them in the face and speaking into their heart, right? And I just know that. I saw that with my child throughout his first year in public school. And it's just something I hold very dear to my heart, with the challenges that I have in school, and that I don't want my child to repeat. So I just want to share and discuss what Dr. Johnson said, that children are a reservoir and they will increase transmission. Let's speak about childcare, that our children have both been in childcare with class sizes ranging from 7 to 30 this entire time. I mean, since school ended, this entire time, up until now, right now, still today, as I'm sure thousands of other families have around this valley. And despite this, there are not childcare workers sick and dispersing COVID in our community. If what Dr. Johnson hypothesized is true, we would see hundreds of childcare centers closing due to sick employees, and this isn't happening, right? I mean, they've gone, he's followed the rules of when masks were required, which he doesn't do well, but he did it. He's done it well, okay? And he's followed the guidelines. And these are in big class sizes, ranging from kindergartners up to 5th, 6th graders. The kids that can't stay home. Well, parents need to go to work. We need to get back to parents not, kids not sitting at home, with a grandparent watching that is in their 70s or in their 80s, and filling in the gaps for this missing critical piece for our children. So I just want to share love. I want to thank all the other parents that have shared tonight, that just deeply touched and moved. Laura, I love your background. I want to be there in my mind and heart. I'm there on that beach with that blowing palm tree. And I just thank you personally, Laura, for who you are on this board, and for all of you the new ones that we elected and that are in position, that you guys just remain thriving and empowered to make these hard decisions, but hear our voices as parents over these children. We love you. God bless you all. Thank you.
Thank you, Josh.
That should be it for public comments. Again, if you had any technical difficulties and you're watching on the stream, make sure you can communicate that. The board will get a copy of your written comment if you provided that. And if you still needed to provide some comments to the board and didn't have an opportunity, they're always welcome to those communications through their emails. You can find them on our Wenatchee School District School Board website.
I just want to note that the board did receive a number of emails today, mostly, and some yesterday. I just want to assure everyone who has sent us emails that those have been received, and we have seen them and read them. At least I have. I'm sure other board members have as well. So your voices have been heard, and thank you for taking the time to reach out to us. And now on our agenda, I believe we are turning it over to a presentation by our staff.
Yeah, Laura, thank you. And I too want to thank everybody, our community members who sent in emails, who participated in public comment and shared their perspective on where we need to be at. Coming to this recommendation tonight was one of the most challenging decisions I've ever had to make in my 25, 8+ year career. Because as parents said, as staff members said, there is nothing like in-person instruction. We know what a difference we make when students are with us. We know that interaction between a teacher and a student, our staff and our students is critical to that relationship. I know how important this is. I also, since March 17th, I have been in weekly meetings with health professionals from the region and from throughout Washington and throughout the United States, continuing listening to their recommendations and really being very reflective on each and every one of their comments. Over the past couple of weeks, more local experts, medical experts have joined the conversation. And you heard from Dr. Mark Johnson, an infectious disease specialist, Dr. Peter Rutherford, the CEO of Confluence, Dr. Malcolm Butler, Administrator Bruce Buckles, and many, many others. And it became very apparent that the risk was too great for us to be sending back our students, even for our youngest students. We've asked those questions. We've asked them directly to the health professionals. And from their perspective, the risks are too great. I've seen the same information as everybody else. It's about a 0.1% death rate amongst young people. For our district, that would be roughly 7 students. As a superintendent, many people think that my #1 priority is academics. It's not. My #1 role and responsibility and my commitment to the board is to ensure the safety and well-being of our students, of our staff, our parents, and the community at large. That's a task, a burden that I do not take lightly. It is one that I embrace, one that I make sure that I follow through with. This is a virus. This is a medical issue. This is a health issue. It is why I've had to lean into the medical community. It is why I sat and listened and really, again, reflected on what they had to say and why I brought this recommendation forward to the board. Our recommendation is based on the medical aspect. But what we want to present tonight is how we're going to move forward in a 2-staged plan, our smart restart. And as others have commented, prior to the last 10, 15 days, we were headed down a very different path with face-to-face instruction, with hybrid at the secondary level. But the infection rates continue to escalate to the point where the doctors, the medical officials, and others were saying the risks were too great. So we've made a significant shift. Our recommendation tonight is to go online for all students starting August 26th. Again, the principles of our recommendation is the safety and wellness of our students and staff. 2, to deliver high quality instruction to students, regardless of where they are, at home or in our buildings. Provide choice in instructional delivery, and we'll talk a little bit about that, having 2 different online options, and flexibility of transitioning between instructional models when appropriate. We know, we hope, we are hopeful that by following all the health recommendations, the mitigating strategies of masking, social distancing, hygiene, and others, that we can reduce this infection rate from our current 425, 450 to down somewhere in the neighborhood, where the medical professionals would be more comfortable with us. Our smart restart plan, really the guidelines I apologize. The considerations were this was all about the medical considerations, all about what was going to create safety. We are going to have 2 stages, a continuous learning 2.0, which would start August 26th, and then a stage 2 hybrid online in person when it's safe to return. So we are opening our doors on August 26th. All students, or the vast majority of students, will learn in an online situation. Pre-K students enrolled in all physical schools will continue instruction virtually with their classroom teachers. We will talk a little bit later on tonight about the structures that we've created to make sure that our kids are engaged. We did hear the work that was occurring in the springtime. It was an emergency plan. I am eternally grateful for every educator, every staff member who helped us figure out the first version of online learning. But we learned a lot. We learned a ton, and we know we can continue to get better with it. Ryan, if you'd go to that next slide. Feedback, we receive feedback from our stakeholders. We receive feedback from our teachers, our parents, our students, about how do we continue to ensure that we're getting better and doing this work right. We've selected a new learning management system that Ron will talk about. Really thinking about our professional development for students, teachers, and parents. Working with our educators to create units of study framework to provide a consistent and robust learning outcomes. And students will return to assigned due dates and grades, pieces that feel very similar to a traditional learning, although it will be online. Next slide, Ron.
I can take it from here, Dr. Gordon.
Yep.
As the Assistant Executive Director of Learning and Teaching for the Wenatchee School District, my name is Dr. Stacy Bain, and it's an honor to be here serving in the Wenatchee School District. I'm responsible for K-5 elementary education, and I'm also jointly responsible with Executive Director Michael Lane, who will speak in the next slide, for quality educational experience in the Wenatchee School District. So we work with curriculum, instruction, and assessment. When we think about the littles at the elementary level, we want everybody to know, all of the parents, all of the stakeholders, the taxpayers, the citizens in the community, that we hear you. The littles are the most challenging in terms of an online setting. So we, as a principal staff, elementary leadership team, and the Learning and Teaching Council, have been racking our brains and working industriously to provide some type of a transition plan that will help us to scale all of our littles to be online. What that will look like potentially, and this is all a draft, as we know, we have to be flexible. At the kindergarten level, it would start with our WA Kids assessment. We have done this for the last several years, in which we invite families to the building. We will have people masked. That is the plan, socially distanced. We will provide that, that assessment. We will provide the family orientation. We will provide opportunities to interface with the technology and help support parents in a one-to-one manner so that our kindergarten scholars can start out on the right foot. We also are planning for grades 1 and 2 to potentially have, just for this orientation period, a meet and greet with your teacher, again, socially spaced, and an opportunity to understand what the school day is going to look like, how to log in, and how to be in community with one another. So basically the point of this slide is to just assure the community that we are lockstep with the parents who are worried about, especially the littles. How do we continue to ensure that scholars will read? How will we ensure that scholars will be socially and emotionally well and able to live in community with one another? I also would like to let you know that I am committed, and the Learning and Teaching Council is committed to a drive to 95, that we will ensure that 95% or more of our scholars will learn how to read at grade level, and that will be regardless of platform. I'll hand it over to my boss, Mike.
Hi there, Mike Lane, Executive Director of Learning and Teaching. Thank you so much. So on the next slide here, we're talking about some transitions at some other grade levels. Obviously, it's very important for our youngest students, our kinders, even first and second grade. But additionally, it's important to provide some effective transitions for our incoming 6th graders and our incoming 9th graders. They're experiencing secondary school, 6th graders in particular for the very first time. This slide kind of lays out the plan. We would really prefer to be using some form of socially distanced in-person orientation so we can really focus on relationships. That social emotional learning piece at the middle school level, they will be getting their iPads distributed to them, and they'll need to be shown how to access the technology and also how to develop new routines as a secondary student. Wenatchee High School is already knee deep in doing some virtual transitions for their incoming freshmen. They've done leadership, or they will be doing a virtual leadership academy coming up very soon, in addition to the freshman orientation transition, which is a program they call Ignite. They would also like to do in-person walkthroughs focusing on our new learning management system, Canvas, which Ron will talk about on the next slide. The fact that 9th graders, many of whom for the very first time will be actually getting credits towards graduation, and all the various supports that are available for students. Westside has 3 different days set out for, at this point, virtual transitions, really focusing on relationships, social emotional learning, and the leadership component. One of the things that we've also discussed is in the fact that if we are all online at this point, that when we are able to safely transition to more of a hybrid model, that a lot of these transitioning activities could be replicated, definitely replicated in person, because we know that potentially for the very first time, some of our students will be walking into these actual school buildings and really need to get the lay of the land. So this will be kind of a ongoing process as we transition our kiddos, our new kiddos, into our buildings. So Ron, I'll pass it over to you.
So I'm Ron Brown, Director of Technology for Wenatchee Schools. We put together from the recommendation of the state, from our focus groups, from parents. We heard this from every focus group, actually, parents, students, and teachers, along with the state superintendent, to have a unified platform for delivery of online content, whether we're hybrid or fully online. So this was going to be an eventuality for Wenatchee School District, regardless of our start, because we would have been in some type of online learning for our learners. So we chose Canvas through committee, as we've talked about at a previous board meeting. It is a very robust tool with an incredible community behind it. And we are just now standing up our own version of it with our own themes and colors, and getting people in and getting people used to it. It will be the one-stop shop for our parents and our students and our staff. So when teachers are posting content, when they're working on their unit plans, which you'll hear a little bit about in the future, they're going to be posting those in Canvas, and that will be the start point. That will be the place where all of the communication happens to the student. It'll also be the place where parents can observe what's happening with the student's classroom and access those same materials in a view-only mode, and also have interaction with their own students in the platform, but then the teachers of the students in the courses. So those are important pieces of communication that will happen. It will give us a consistent interface. It'll give us a consistent design. And from K to 12, even if the grade levels might look a little different, that consistent place of this is where you go, this is how you get there, this is how the parent can log in, all of that will be consistent pre-K-12 in Wenatchee School District moving forward. So we're committed to using this, we're committed to professional development on it, and we're committed to increasing our teachers' expertise, because this will be new to 500 plus teachers and other staff members who will be using it. And we're making that commitment and investing a lot of time, and as you know, hard-earned public money into this product. And from what I've seen so far in the community that I've spoken with around the state of Washington and others, we are not going to be disappointed. I'm very encouraged from what I've seen so far, and it is an incredible tool, and I think it will make us grow leaps and bounds, regardless of going online only or not. So I think it will be a benefit to our district. So one of the things that to show you, to give you, to wrap your heads around what could this look like. And we're not going to go deep into the weeds, but I want to show you 4 of the templates we chose for certain grade levels. So we had a committee choose kind of the starting page. So again, these are right from the company. So these aren't customized, but it gives you a kind of a flavor idea of what that entry point looks like for a parent or a student. And it's in, we build a very easy interface so when they log in, we can do those by subject, we can do those by big buttons and banners so that it makes it very friendly for our parent group to follow along with their kids, but also for the littles, as Stacy calls them, and our bigs, because this is new to everybody in Wenatchee schools. So there's a couple examples. And then our secondary, a little more traditional focused. As you can tell from the tiling, again, that's just the first page. Canvas lets them put in all their learning activities, all their quizzes, all their assessments, all of those learning components can be attached to those courses in a consistent manner. And we can have teachers helping each other and professional learning communities of teachers supporting each other as they learn this new tool. And one of the most powerful things that I've seen so far is just the community outside of Wenatchee. The YouTube channels, the Facebook groups, the other resources that our staff will have to glean from and pull from to make really rich learning environments for our kids online. So it is very opposite of what we experience potentially in the spring in some of our homes. And we did a lot of work in the spring, but it just wasn't in a consistent interface as Canvas is going to let us do.
Thanks, Ron. I'll head into the stage 1 continuous learning version 2.0 for the K-5 schedule. So the one highly regarded question and popular question in the community is, will our littles and will our bigs be online from 7:30 in the morning until 3 o'clock in the afternoon? And the answer to that would be no, that littles and bigs would not be, and I'll again speak to K-5 and then my leader Lane will speak to 6 through 12, that we will have a school day in which, as Ron just mentioned, with a Canvas template, people will go in at 8 o'clock in the morning, log in, and we can imagine that at K2 it would be circle time. So our morning song, our calendar, etc., coming together in community. Then we would have an opportunity to have some type of content instruction. Perhaps it's math, perhaps it's reading, content instruction. So there's time for individuals to be learning virtually, and then there's an opportunity for students to close that computer, head into their work. We have a system in which we are currently going to scale up the opportunity for people to have physical materials at home at the K-5 level. Actually, we're working K-12, but there would be some time for people to kind of be scholars to be heads down in their work as well. So just as what we would do in the classroom, there are times for educators to provide instruction that is based upon the learning objective with a clear learning outcome. And there's a time for a scholar to have an opportunity to practice what they've learned. And so that's what you'll see reflected in that K-5 schedule. Mike?
Yeah, thank you, Stacy. So next slide there, Ron. So the next slide would be a sample of a middle school schedule, and Stacy did a good job of talking about the variety that would be built in throughout the day. There would also be times for lunch break times, as well as PE or elective type activities that are built into this schedule. We started doing some work with our learning design team, which is a group of educators we've got pulled together, led by Stacy Bain, really helping to provide some supports for our teachers going forward. And one of the ideas that they are working on is the idea of student triads, or actually small student groups of 3 students are able to work together online, potentially independent of their teacher or under the guidance of their teacher, which would continue going when we move back into a hybrid model and those kiddos are back in person for at least 50% of the time. Ron, take us over to the high school schedule. The 9 through 12 schedule is very generic because each high school student's schedule would be quite a bit different based on their pathway to graduation, but that gives you an idea of what a schedule would look like, and it gives you an idea of the sense of structure that would exist throughout the day. which is something through all the public forums that Paul and I did. We heard that from our staff, we heard it from our parents, and we actually heard it from our students. And it was really quite poignant to hear students, middle school students, say that what they really needed more of is structure. They needed a schedule. They needed to know exactly what they should be doing at 8:30 in the morning. And so that's what we're trying to provide with that. So Paul, I think I'm passing it over to you now.
Thank you. And Kelly will be joining me with this one as well, the next couple. This is a question that came up in the public comment and a couple of the emails as well. And this is all around, the students who are furthest from educational justice. And this is also a requirement by OSPI, the Office of the Superintendent of Public Instruction. And ensuring that we're really being thoughtful about our students with IEPs, students who have significant poverty in their life and may not be able to connect to the internet, for those students who may have challenging home lives. We really need to be thoughtful about how do we bring some students back into our schools, because we recognized over the past the first 3 months that there were some students that were not able to connect, virtually through the technology, but also just connect in a personal manner with their teachers. And we're trying to figure out different ways to be able to support this small group of students in being in our schools on a very consistent basis. Because one of the things that we don't want to do is continue to grow the gap between students who are not in poverty and those who are, and really trying to make sure that we're being very cognizant and thoughtful about our plans that we move forward. Kelly's going to talk a little bit about an idea that we are working with our school leaders around structured daycare, and then at the middle and high school, more student support. Kelly?
Yeah, so I think a lot of what we heard throughout this entire closure is that our parents are going to need some type of childcare, and that our students need a place to go that is structured. They can get some assistance, and we also need our classified staff to help us staff this. So really what we're looking at is doing a limited number of seats in our buildings, essentially 5 kids per classroom. We cannot use all of our classrooms. So it's maybe using 50% of the classes in the buildings, having the kids obviously masked and socially distanced, staff as well. And really what this will allow is our students to follow their school schedule. Our staff will help them with limited tech issues and provide that academic support that some of those kiddos are really going to need. Since we will be providing those free and reduced, free meals, those students will also get that. At the middle school and high school level, we're looking for that support structure, a safe place for kids to come in, do their work, follow their classroom schedules, and have that ability to reach out and chat with some adults. We're looking at a host of different options as well to provide different access for different types of students to come into our buildings and get assistance, whether that's tech assistance or academic assistance or just social emotional assistance.
And just to be clear, this is not where teachers are going to be teaching these smaller group of students. This is where, as Kelly said, it's going to be more of a structured environment with a classified staff member in the room or in the area with 5 students. It's limited, but it is a response to this educational justice question that we've been asked tonight and that the state superintendent is requiring of us. Ron, next slide.
Yeah, so for our staffing, we've really been collaborating with our association leaders. For the Wenatchee Internet Academy, we are going to try to staff with our current Wenatchee School District certificated staff members who are possibly unable to go back into a face-to-face classroom setting. And then we are going to work with our classified staff members to find different ways that they can help with the robust, structured, and consistent instruction for our students. We feel that they're really a vital part of our education system. And so we're just looking at a number of different ways where we can use our classified staff. And that can be virtual classroom pullouts to help with small groups or individual students who are needing additional assistance. It can be in that structured childcare. It can be setting up help desks. Again, like I said earlier, we are looking at a number of ways that we can use our classified staff to really help with this. There is that potential that we might have to do a reduction in force. We are really trying to not go that route, trying to find a lot of different opportunities for our classified staff, but we do want to put it out there that that is a possibility.
One of the things that we heard frequently from our community is that to not forget about our community and our parents as we are talking about providing support, especially around the technology piece. As we're going to a fully online model, we have a group of educators. They are formally known as the technology rock stars. That's what Paul Gordon has dubbed them. They are a group of 35 people who are working with Stacy Bain and Ron's folks on the tech side to really identify and set up training that our staff needs, that our students need, and then without forgetting about all the support that our parents are going to need. And one of the things that I think our parents will appreciate the most is that learning management system that Ron walked us through previously, that there's a one-stop shop to access all the different materials and processes that your student is going to need throughout the course of the day. And I'll let Stacy talk about the community outreach piece.
Yes, and so that just pairs well with our plan. What we heard tonight was that elevated concern of how are we continuing to reach out to all individuals in our community. And so what we're planning, just within the last 24 hours, I would like to commend the work of Director Sarah Hall and Director Nadia Bush, because they already have brainstormed a variety of reach out sessions in which we as Wenatchee School District employees will embed ourselves in the community and provide an opportunity for which obviously we would maintain socially distancing practices, et cetera. But we will provide opportunities to connect with families, to have people understand how to navigate the technology. Not only this is the device, this is how you turn it on, but this is how you get into Canvas, and this is where you'll see what all of your different pieces. So just know that that is in the works. The first day that we will be upright, with that will be before school starts on August 19th, and then we will have consecutive evening events in English and in Spanish to ensure that we are reaching all of our community and we can get everybody engaged in the school year.
The other piece that I'd out, we've also reached out to different Latino community organizations, Cafe, Parque Petrinos, and others to try to make sure that we are doing this in partnership and making sure that we're communicating throughout our entire area. So we're excited about those partnerships and look forward to them. So thank you, Stacy. The other piece that we have is the Wenatchee Internet Academy, WIA. And this is an online virtual learning for parents and students who are choosing to do online learning the entire year. They're saying, this is where we want our students to be, or if I'm a student, this is the learning that I want to engage in for the entire year. And we currently, as of this afternoon, we had roughly 175 students registered for WIA. We're extremely excited. Really proud of all the work that is going into it. We're continuing to refine it each and every day. We were on a really thoughtful phone call or Zoom meeting today to continue to refine what we're doing here. But this is, again, an opportunity for students and parents who want to have online learning the entire year. We have information available at wenatcheeschools.org/WIA for any parents who want to learn more about that program. In stage 2, we believe that we will be in a stage 2 if we're all following those mitigating strategies. masking up. Went out in public, really making sure we're doing the hygiene, social distancing, and we're reducing that infection rate within our community. When we're able to be in that place, we will more than likely return to a hybrid. We're planning for that as well. Know that a lot of time and thought has already gone into this plan around what would this look like. And this would be a hybrid for all pre-K through 12. Early thinking is that we would be bringing our preschool and kindergartners in as soon as the medical officials were allowing us to do that, followed by the second and third grade students, followed by fourth and fifth grade students, and really trying to make sure that we're being as thoughtful and careful as possible. Again, once the medical officials give us that green light to move forward. I just want to reiterate, we would much rather be face-to-face instruction. That's where we know we do our best work, but we're in a place where that's just, the risk is too high. But once we get into stage 2, we will be moving into a hybrid situation. There are a lot of, within our Smart Restart, there are a lot of supports. People spoke about it tonight, emailed us, and continue to ask. We're going to continue to make sure that we're serving our students furthest from educational justice. We're developing plans to partner with different programs around daycare and structured daycare, as you heard Kelly speak about. We are going to continue to provide meals for our community. Chris Lutkin and his nutritional service team couldn't have better people doing incredible work for our community. Great article in the Wenatchee World where partnering with the farmers market on Saturdays and making sure that we're able to give out fresh vegetables and fruit to our community members each Monday. We're going to continue to support the technology and internet access. Ron Brown and that technology team have just been working tirelessly to ensure that we're ready to go, that we have the needs, the physical technology, but also that support. And we heard that Mike alluded to this a while back during our focus groups. We need to be there for our parents just as much as we have been there for our staff and our students. We're going to be there for our parents as well. Stacy and I spoke a little bit about this one, this community outreach, dual language resources for online learning. Those are all those supports that we're going to be there. We recognize we're in a medical health situation, but our next task was to take on this education and ensure that it is robust, it is rigorous, it's structured, and it's consistent, and that we're bringing supports for our parents, for our students, for our staff, so we can continue to move forward and do great things by our kids. Ron, next slide. On August 11th, our next board meeting, we'll be bringing forward a detailed, comprehensive plan that talks about stage 1, which is continuous learning 2.0, and stage 2, which is the hybrid model, and then continuing to move into more face-to-face instruction. We talk about from the hygiene to busing to moving students in and out of our schools. We talk about our technology, we talk about our communication. Communication throughout this is going to be imperative, that we continue to hear from our stakeholders. We continue to hear from our students, our staff, and our community, and our parents about where are we at as we launch on August 26th, when we open our doors virtually and the real doors of our schools as we open up. We're excited about this. We believe in our plan. We believe it's the best plan going forward. We believe in this recommendation because it puts student and staff and community safety first and foremost, but it's a thoughtful academic and instructional plan that will meet the needs of our students. And we will continue to iterate, continue to improve, continue to get better with our instruction. So with that, Laura, I'd hand it over to you and your fellow board members to ask us any questions. Cabinet, if you would turn back on your video as we were prepared to answer any questions.
Thank you, Paul, and staff for leading us through that presentation. Board members, I would ask if any of you first have any comments or questions that you want to ask of Paul or the staff.
Paul, quick question. The kids who will be potentially able to go back at the 5 per classroom, these are just students that are identified in these hard learning, difficult situation groups, not something like I couldn't send my kindergartner there with no special needs or anything like that.
On the educational justice side, correct. We are trying to figure out a structured daycare situation, but that will be also for a limited number, but that would be kind of on working with potentially a partner like the YMCA. Kelly, anything that you would add on there?
Yeah, I was just going to add, we are in conversation with the YMCA to see what type of services they can provide and what kind of facilities we can help provide, and then we could potentially offer that up.
And that would look similar in nature because we want to keep the safety at the forefront, where we would have 5 students, a staff member with them, and not from I'm not teaching, but I'm in the structure to make sure we've got a physical space and we've got technology ready to go. And then I'm also able to take students out for recess, go to lunch, and do those types of things. If it were through the Y, there would also be some before school and after school, kind of those traditional before and after schools. So we're really trying to work through that as well to give some of our parents an option to use that, because we recognize, Julie, I said this to you, we think about the Julies of the world who husband and wife are working, spouses are both working, pretty intense jobs, and having young students at home. We know how challenging it is. Diana Haglund, our director of communication, is in that same situation. So we see it each day where it's really hard to do your job and try to teach each day and helping your child learn each day. So we have that. You are right at forefront of our thinking when we think about these structured daycare solutions and working with different partners to make sure that we can provide that for some members of our community.
We heard from a couple of those people tonight. We heard from 2 folks that work, a couple that work in healthcare, which is, pretty essential function in our community. But we also heard from parents at Lewis and Clark Elementary talking about food production workers. Is that how she termed it? I don't know. But I thought that was an interesting new idea. I mean, I hadn't really thought about it in that way, about what we might do to support folks food production, who are working in food production, because we don't have people working in food production, we don't eat.
Yep.
Are we doing anything in that vein, Paul?
We're early into our thinking around the educational justice and really trying to make sure that we have an objective criteria that we're able to identify students, because the hard truth is we're a district of 61% poverty. We have 500 students who have been identified as homeless. We have some significant challenges within our district and our community. I wish to goodness we were able to offer this to everybody. It is going to be students who are furthest from educational justice. And what does that look like? It does look like that one slide where we were talking about, where some of our counselors and principals know of students who are in a really challenging home environment, and that could be through abuse, that could be through a number of different situations. We know a number of our students who are homeless, and trying to make sure we're connected with them. So we're going to work through that. We'll have more of that on August 11th.
Okay.
Paul, another question. Can you speak to how frequently you'll be evaluating the COVID statistics and when we can get back in? Because, we talked about it yesterday on the phone that some schools on the west side are saying no person till December, and I understand that's not your intention.
It is not, Julie. Great question, and thank you for asking that. We are not putting a hard date on this. We are really going to be working with the local health officials here. Again, Dr. Johnson, Dr. Rutherford, Dr. Butler, and others who are super focused on the Chelan-Douglas County. And once we have an acceptable rate, I want our students back in. And that's why we already have that stage 2. And we already in our heads know that who we would bring back in first, and then slowly start bringing more students in. So we do not have a hard date that we are out until January 4th or something like that. We're saying we're going to be very flexible. We're going to work with our health officials and making sure that we're being as responsive as possible. So thank you for that question, Julie.
So another one.
You're good. You're good.
Sorry. For those who are listening, that I am also very impacted by this, and am feeling the pain of all the parents that the online thing in the spring was not as desirable. So of course there's some skepticism going into this, 2.0 version, but at the same time, I'm not a health expert. I defer to the health experts or what we're told to. So I understand that concern. So one of the questions that I know I'm asking, others are asking, is we've had kids in daycare now at our facilities since March with no significant outbreaks and things. And so it's hard to reconcile that with this idea that now it's not safe to go back. Is there any, can you speak to that a little bit? Why that works and this won't? This is not an option.
It's, again, another great question. Those were very small. We worked with the YMCA, and another shout out to the YMCA. What a great partnership that we've had with our local YMCA. Brogan has just been amazing to work with. Mark Helm, Assistant Superintendent Mark Helm, has been leading that effort. And I would have to say, it was not like one of our parents who talked about their daycare. Ours was very tight. Even though we've been doing this for 6-7 months now, we're still not perfect at it. So Julie, there were a lot of protocols. We followed all the mitigating strategies in there, and it worked. You're right, it worked. But we're still small group sizing when we did that.
I do also want to say the YMCA also hosted Eastmonts, and they did shut down for a period of time.
Good to have a team. They always know more than I do.
They shut down because they had positive cases?
Yes.
Okay.
They shut down for a week or two, and then they started back up.
I mean, to Julie's question, there have been children attending daycare all this time and who haven't become sick, who haven't had children in their group who have become sick, and for whatever reason, maybe it's the luck of the draw, but it's difficult to answer parents' questions or to be faced with making a decision to go completely online with no in-person school when folks are having the experience that it's working. My kids are fine. And yeah.
I get it. And it's literally why I said at the very beginning, me and the team, we're really good in education. I'd put us against anybody educationally. This is a virus. This is a health issue. And that's why I had to lean into experts like Dr. Mark Johnson, Dr. Peter Rutherford, and really listen to them when they say, you're right, students may not, but we have not been tracking all those kids who've gone home and maybe infected others. And somebody who said this earlier, I thought it was a really important point. We have some within our community who live in multi-generational families together. I think for me, and why I feel so strongly about the recommendation is because it is with the backing of local health officials people on the front line doing this work each and every day, people that many of the board members know personally, and we trust them. This is not an outside organization coming in and saying, you should do this. This is not from the feds. This is not from Seattle, from Spokane. These are people with actual children in our district currently, and doctors who've had children in our district for many, many years. And that's why I feel really comfortable about this, because again, ask Mike, ask Stacy, ask my team educationally. We're going to be right there with the best of them. But I have to lean into our docs.
So, Paul, I have a few just questions and comments. First of all, that was a lot of material, probably for all of us to process, not just the physicians at the beginning and the public comments, but also you and your team's presentation. I would love to get that sent to the board, just so we can, because you're trying to look at all the details. It's kind of hard, but I so appreciate it. And I just want to point out that the educational justice, the kids who are furthest from receiving that, what a great point of the board's focus on equity to address that with these students who need that, right? So I appreciate that when we do eventually open up, that those, as we're opening, those kids are going to be prioritized. And because you're right, as we can safely bring people back, we have to kind of look to see who needs it the most. And I think that speaks to the board's value of equity so well. So I want to thank you and your team for just highlighting that. And I know that these, like you said at the beginning, this was probably the most challenging decisions you guys have ever had to make in your careers. And, and I'm sure that our healthcare folks who spoke tonight, again, they have kids in the district and they have conflicting ideas, but we all want to keep all our students safe, right? And even if it's a small percentage of people who could get sick and die, we want to see everyone succeed in not contracting the virus and not having what we call morbidity issues, which is when you get sick, but you don't die, but you have all these negative outcomes. So I appreciate that the team has been very thoughtful in considering all the health issues, because again, maybe we are just dodging a bullet with our childcare, but again, we don't know if the kids are asymptomatic and potentially passing that on. So let's hope that our good luck continues with our small children, and hopefully as we hopefully our county will go down with rates and we can see our schools eventually opening up. But so much information. Thank you so much. And I'm excited to hear about the possible childcare for those who need it most. I think that would be really serve a great function. It would give our classified a role in earning money, because I know everybody wants to keep their jobs. So thank you so much. And I look forward to seeing that PowerPoint online or in my mailbox or something. Thank you.
It will be both. Kim will post it online for the community, but we'll have it in your email the moment this board meeting's over. Thank you for that.
And just a quick comment about the public comments. We had some really wonderful suggestions from an audiologist and some other focuses, IEPs. I hope that that our special ed teams and others will kind of take a look at those ideas. The Lewis and Clark, Karina represented the Title I and talking about food essential workers and having childcare for them. I hope that all our staff can be looking at those ideas to see how flexible those are and whether those can be implemented, because I think there's some really great creative ideas that, you know, we're all trying to have to come to terms with during COVID. So I'm glad that community members are offering up some ideas that might just be really helpful for a lot of people.
Totally, I totally agree, and we were all taking copious notes because they were very thoughtful suggestions. So, and I appreciate that.
Thank you.
Other board members?
I just want to chime in and just, I know this was part of the PowerPoint presentation, but I think training for parents is going to be huge. You know, I appreciate that it's there. And, you know, I think it chimes into the whole equity piece. We need to make sure that we're reaching out, experiencing this as a parent in the spring and for summer school. I can tell you there's a lot of room for improvement. And I think we just got to push it out there and go beyond the whole electronic system. Let's go beyond the whole Zoom system. Let's go beyond, you know, just we need to go out to their communities, whether it's, you know, going to the Bruce, you know, going to Parque Padrinos, you know, going to some of the packing sheds. Of course, it's doing social distancing practices and whatnot. But I think we really need to go deep down and, you know, ensure that every family has the devices that they need, ensure that they have understanding, basic understanding of how they can support their student with the electronic piece, resources at home. Okay, if you can't, this is how you do it. You know, these are some roadblocks that somebody that's not so tech savvy or is not, doesn't feel comfortable talking to the educational system will encounter. Again, you know, I think it's really important that we tune into the community that we have. Unfortunately, like I've said before, we're not Mercer Island, we're not Bellevue. And so we can't, you know, work strictly on the electronic piece, communication that way. So I really think this is huge. It's just something that like I said, you know, something that we've experienced as a family here. And I think that will, you know, set the ground for great stuff to come, given the situation we've been given. I did have one question when we talked, the presentation walked about the walkthroughs for at the high school level. Is that a virtual walkthrough or is that an in-person walkthrough?
Mike, you closest to that?
Yeah, they would. Their preference would be that would be an in-person walkthrough, small group, socially distanced, masked, potentially using outside. I know as a cabinet, we're still kind of working out the logistics of that, trying to prioritize our youngest students first. So quite honestly, the high school, in my work with them, Donna and Molly and Eric and Ricardo, what they are telling me is they can, at this point, they can do it either way. Their preference would be to bring those ninth graders into for some form of in-person transition now. But if need be, they could wait to do the in-person parts to the time when we transition into hybrid, and they could do that transitioning stuff at this point online.
My only concern is that it almost seems like we're either all in or we're not, you know. It just feel like, okay, we start letting these little pockets at the middle school, at the elementary level. I think I heard it through kinder also. So that's just a concern of mine. We know, we've seen, you know, when children are given a chance, they see their peers. That's just a concern if we kind of start introducing for little pockets here and there, that if we're, you know, we're gonna go full out, that's a concern. You know, dealing with kids. Oh, I mean, I can guarantee you my child will embrace the next peer he sees, you know, even though he's fully aware. So, you know, just to be the concern there.
Thank you.
Thanks,
yeah, and to your point earlier, absolutely. We are going to be in the community. We're going to have a physical presence out in our community, making sure that people hear from us, that we're able to share the technology, do all the pieces that you spoke about. So we will be there. We have already reached out to different partners, and we continue to fortify those partnerships and make them even stronger.
Could one of you speak to teacher readiness. You know, we did online learning in the spring, and you know, we had sporadic success, and now we're going across the board. So how do we assure people that our teachers are all going to be ready to go and up to speed and delivering quality curriculum and quality experience for our students?
Yeah, I'm going to kick it off, and then I'm going to hand it to Mike and Stacy real quickly. It's a great question, and one that has kept all of us on our toes this entire time, as we knew we were, you know, even when we were planning for hybrid, it was a high level of concern. How do we deliver a rigorous, robust, consistent, structured education? And the pieces that we're working on, we're bringing in a number of educators virtually and having conversations around making sure that we have quality units of study that have set essential learnings per grade level and outcomes that we want to see by our students through different types of assessments. We're working to ensure that we have those up and running, and we're working with our educators, a small group of, well, it's not that small, about 40, 50 educators, so we can continue to work with the other teachers when they return. Stacy, Mike?
Yeah, I'm gonna kick it over to Stacy, because Stacy can put some numbers to that, what you were talking about, the group of teachers that we are bringing together to provide support to their colleagues. The idea of the daily schedule, the concept of using a single learning management system, those are things that we heard from our teachers as well, that they needed that kind of structure, they needed that kind of organizational piece in there as well. We have actually worked with our WNEA, our bargaining unit for our teachers, and moved one of their, there was a PLC day built in later in the year. We've actually moved that to August. Our principals and our teachers now have 4 full days prior to school starting, so we can just really hit the ground hard with professional development and time for collaboration for our PLCs to be preparing to provide a rigorous learning experience. Stacy, do you want to kind of just run through the breakdown of those groups of folks
Sure.
that we've got and the supports we've got that we're putting in place?
Sure. Our goal since the beginning of the summer was, well, actually since the beginning of COVID in March, was to not be flat-footed for the 2021 school year. So in June, when we were thinking about the various models in which we needed to scale for online, hybrid, in-person, not in-person, we knew that the first thing that we wanted to do was focus on the development of our staff. Therefore, we created a team of 20 individuals, again, to Mike's point, under the leadership of Dr. Paul Gordon and Executive Director Lane, and their sponsorship. Couldn't have done it without them. 20 learning designers who, yes, did focus on the hybrid model, what would be the components that would be efficacious, and what would be a unit plan design that would be efficacious as well. We then read the tea leaves and thought, well, Dr. Gordon read the tea leaves and thought, oh, this is turning towards online. Let's add 35 individuals who were highly successful in that platform in the spring. That takes us to 55 educators that we've been working with. We are going to scale to 68 additional educators, because why? Because our purpose is, this is going to be a total of 123-ish. Our purpose in scaling so many people right now in the summer is that it is true that August 19th is right around the corner, 17th. It's too soon when all of our staff will be back for professional learning. We do have a detailed plan for those 5 days, to Mike's point, but we cannot, as a cabinet, scale 500 people with understanding Canvas, understanding unit design with clear outcomes, understanding clarity around learning for our community, understanding how to teach people how to read regardless of platform. We cannot do that with 5 individuals. We need more help. The harvest is plentiful. So we have needed to scale our workers. And I would like to give a shout out on behalf of the learning teaching team under Mike's leadership. WSD educators have risen to the challenge. They have sacrificed their summer to make sure that they are trained up so that they can help support and train other staff members. That's our plan.
The other
to scale
piece
within our organization.
Thank you, Stacy and Mike. I think the other piece, it is so critical, and we haven't spoken enough about them, are our school leaders, our principals and assistant principals. Because at the end of the day, they're the ones who are charged with each and every one of their buildings. And again, they've been right alongside us. They're continuing to give us feedback. They're continuing to challenge our thinking, and we push for that. We ask for it every time. Every time Mike and Stacy are with them, they push them to say, think bold, push us, ask hard questions. Don't just accept what we're putting out there. And they have been tremendous leaders and supporters of the work. And we know we can do this. We know we have a short turnaround time. And it is another reason why we wanted to make this recommendation tonight, to continue to get us moving forward and not waste any time with this direction and with the speed that we need to ramp up the level of knowledge around the units, around Canvas, all the pieces that Stacy talked about. It's a short window, but one that I know because of the people that are with us, we'll be able to do it.
Paul, another question. What types of resources are we going to be able to make available to parents maybe that, you know, like me, 2 parents that work, even if I wanted to stay home and supervise the learning, it was a disaster, you know, in the spring for the parent to work from home and try and supervise. So are we able to put together or put parents in touch with each other of who may want to have the capacity or resources to kind of co-op and supervise some of this learning? I mean, can we put lists or communications out there so that parents can connect?
I love the idea, and you brought that up to me, and I think it's a fantastic idea and one that we will champion. We have a town hall meeting somewhere in all those slides. I forgot to mention town hall meetings. My team's not surprised that I did that at all, but we're coming together with our community. We have a number of people who are already registered, so we can put that piece out there to really almost replicate what we're trying to do at our buildings, where, you know, we would recommend 5 students and 1 adult, really that structured environment that you're talking about. I think it's a fantastic idea.
I'm wondering if, you know, neighborhood kids who are already, you know, together more or less, that wouldn't be useful. But I was just thinking the same thing, Julie, about churches, maybe, you know, that have facilities, congregants who are already in essence, you know, coming together in some way. They have facilities where they could bring groups of 5 kids together in classrooms. I don't know.
I think it's really going to work because of the structures we talked about earlier, that Mike and Stacy talked about earlier. It's not what we did in the springtime. It's really a more structured amount of time. As Stacy said, we're not expecting kids to be on the computer the entire time, but it is school from 8 to 3 or 8:30 to 3:30. It is school, and there's different activities that are going on. There's going to be time where you're going to have some direct instruction by your teacher. It's going to be some other time where the laptop is down and I'm just working. But it is going to be a different structure. That's why I'm confident in having our classified staff members do it, support us within our district, and why I think it's a good idea, Julie, that you're mentioning. So we'll create something for that town hall meeting, and that town hall meeting will be next Tuesday for the parents at 6 p.m. We're also going to have a town hall for our staff at 9 a.m. So if you, again, more information on wenatcheeschools.org for our parent town hall.
So will the instruction be, so I'm just trying to think, instruction will start up, will the district be using the curriculum that's meant for, you know, 8th graders, 4th graders? Will we have access to textbooks? I mean, so the expectation is that we're going to start off the school year online, and we're going to receive the same education as if we were in person. Same curriculum, same expectations, and all that good stuff.
Yeah, Stacy and Mike can add into it, but yeah, our expectation is it is going to be our school virtually. It's not going to be perfectly, you know, a match, but it's going to be dang close. Mike, Stacy?
Yeah, again, grateful to be with a great team, because with Paul and Mike's leadership, they continue to push us in our thinking. And so Director Sarah Wall has a system that she generated yesterday to be able to have a barcoding system for our materials, to be able to check them out to our littles and our bigs. So absolutely. So if we need that ready math book for K through 5th graders or 1st through 5th graders, that would be ready and available. And to the point of wanting people to have a paycheck with our paraprofessional staff, et cetera, really trying to align who do we have on our team so that we could utilize people for work that is compelling. And this would be compelling.
Mm-hmm. And it's I can't remember when, but Stacy, in a different role, presented to the board around our work around literacy. That work is going to be continuing. The teaching, the educators are K-6 educators and beyond now. They're going to be using those structures, those strategies each and every day. And it's what Mike talked about a while ago around having some of our material that we are going to have in our students' hands. Beyond just textbooks, it is the materials we want them working with. So as much as possible, Maria, we're going to try to make this feel like they've been in school all day. And we expect high outcomes from our students. We really do.
And this is part of the reason why if parents are going to enroll in WIA, that is you start, and the hope is that you end in that environment, in that setting. So when I'm going to be positive here, we return back to the classrooms for 2.0, the teacher is just going to be able to pick up where the instruction left off online. Cool.
Perfect. That is exactly how it's developed, and why WIA is a different model for our parents to choose from, because they're going to continue. And you're right, my class is going to come back to me, whenever that date is. And then we're going to start teaching and learning with kids in front of me.
Laura, I don't have any questions, but I do want to do a communication before we get to the action point. So when people finish the questions, I'll jump in.
Okay. Are there any questions, other questions from the board?
Okay, should I dive in then? I think this is relevant because and I wanted to say that I've listened to and thank everyone for their public comment. And I believe that input can be adapted and put into our course of action. And that's really important. Getting out of basics, I agree with the recommendation, but as your representative, I do want to put on the record context, and I want to add some guidance, because I think these are important for the way we think, the way we work, and the way we go ahead. Our job is to make students the priority. We get advice and resources, and we also get hard restrictions and constraints, told what to do, from others who have different but relevant priorities. The health department for one, the economy for another, and we really didn't hear from too many people in that arena today, families, employee organizations. While we listen to and respect these multiple dimensions, we should recognize that each will be skewed in favor of its primary responsibility. We have the difficult task of considering and respecting each input and then selectively integrating them into a balanced decision. Trade-offs will be necessary and justified. Each dimension includes harm and benefit, and no dimension has the whole story. And I might add that what we think is the best action may change or will change with knowledge and time. So that's the scene that I think we really need to understand as we move forward. The next thing I wanted to talk about was a phased or a staggered start, which I have always believed will be the best approach. I'm really glad to hear that the disadvantaged and the youngest students are planned to be first in line, and some even starting right away, to return to face-to-face education. I believe that this is the group that will most benefit from in-classroom school, and their return will most help homes and the community economy. I suspect that this group gives the most doable and manageable task for providing socially distanced in-school education. And I also think that this group will give us the best pathway to learn and improve our methods as we prepare to bring all our students back. And then I wanted to push a little bit on duty and privilege. We're privileged to be working, but we, the district, have a duty to perform, especially for the disadvantaged. What the school district has to do was not expected. It's new, it's strange, and it's difficult. But all of us have got to put in extraordinary effort, especially again for the disadvantaged. And then on a serious but lighter words, please be kind, please be smart, do your part with social distancing, and wear a mask. And I think that background, even though I'm treading over the same path that we've heard this evening, that's a mindset that we really need to help our district staff, our superintendent, our parents, our students move ahead. Thanks.
Beautifully said.
Thank you, Martin. I appreciate your point so much. And just to reiterate one thing, I just appreciate so much the comments from every single person and the variety of perspectives, because as you said, no one's perspective has probably got it all right. There's what's the ultimate truth? Does anybody have the ultimate truth? Probably not. And everybody's reality is different. Everybody's belief system is different. And everybody's perspective and opinion is valuable. And I truly appreciate all those sharings that continue to come in as I'm watching the emails. So are we prepared to take action on this? Are we taking action tonight? Yes, we are. Are we prepared to take action on this item this evening?
I can make a motion. I think it was in our agenda.
Yes.
I thought we were acting on the 11th.
You're going to act. So there's two different pieces. One, you're telling me to move forward with online learning. And then on the 11th, you'll do the formal OSPI resolution. So that one just has to go to the state. This one is saying we're moving in this direction, telling the superintendent we're moving in this direction.
So I move that the board accept the superintendent's recommendation to start the 2020-2021 school year online for a vast majority of our students with continuous learning 2.0 and stage in hybrid learning in person online when local and regional health officials determine it is safe to return to face-to-face instruction.
I'll second that motion.
Okay. It's been moved and seconded. Is there any discussion?
I just want to, I guess, make it clear that we're not trying to be insurers of any health and safety. I mean, we're in the, our responsibility is to teach our students. And I know one person made a comment that, we're worried about getting sued if anyone gets the virus. And I don't think that's the case. I do support being conservative given the health recommendations we're getting and that this is somewhat unknown. And so I don't want to take any chances with the health and safety of our youth, but I also, so I'm supportive of this from the get-go, but I do agree this needs to be as short-lived in some ways as possible so that we can, I think there's more exposure in not, in failing our kids from a teaching perspective in some ways, from a, district liability perspective. But I do agree with, we're stuck with the health information that we have and we need to take it seriously, however we feel about it. But I know we're not ensuring anyone's health and safety. And at some point, I do want to see this as short a solution as possible so that we can get back to the classrooms.
Thank you, Julie, because that has not been the cabinet. I've thought about it, but that has not been a concern that any cabinet member continues to bring up around, oh, we're going to be sued if we do that. That has not been a part of our conversations. Have I made sure that we've done our due diligence? Absolutely. But that is furthest from my thinking and my team's thinking.
I think it's important to me to recognize that it is online with limited selected exceptions.
It is.
Yeah. I agree with the temporary nature of this, the first stage of this plan. I'm glad that there's a second phase built into it, and agree that we ought to move as quickly as possible as the numbers allow us to move into the second phase. And while we are attempting to protect the physical health of our community, I also want to recognize that the social and emotional well-being of students and their social development benefits by having children be around children and learning how to interact with one another. It's an important part of child development. And the longer we keep kids out of that opportunity to interact and learn from one another, the more detrimental it will be in that regard. So we're really in a balancing place as far as I'm concerned. And that's one of the driving reasons, I think, in addition to the burden that it's putting on families in the community right now, that we need to really watch the numbers carefully and move as quickly as we can into that next phase of bringing back in-person instruction.
Well, and like Martin said, I think, you know, as we see our community hopefully embrace continued social distancing and wearing masks, hopefully we'll see those numbers start trending down. I'm hopeful. We'll see.
Hope so. Anyone else? Okay. There's a motion on the floor. It's been moved and seconded, and we will be doing a roll call vote. And I'll start with Julie.
Aye.
Martin.
Aye.
Michelle.
Aye.
Maria.
Aye.
And I am also an aye. So that motion carries. Thank you, Paul, and your team for all the hard work that you have done on this. Appreciate it so very much. And thank you to the community members who have taken part in contributing their opinions.
Yeah.
Yeah.
But I also want to thank the board. Ultimately, this was your decision. I bring recommendations and you have to make the hard decision to vote for this. And I know this was a challenging vote, and I sincerely appreciate each and every one of your votes. So thank you.
Yeah. It's not a fun one.
No.
Okay, so we are next together. I see that we have an agenda planning meeting on August 3rd. And that is Michelle, is that right? Yep, okay. Right. And then there's a town hall meeting on the 4th. Is that still happening? With parents, and also an agenda planning meeting on the 10th with, I'm not sure who? Martin, okay. And our next board meeting is on the 11th, where we will be reviewing the plan that will be submitted to the state. And we're going to see that in advance, I'm sure.
Yes.
Okay.
All 40 some odd pages of it. You will have it in advance.
Very good. Meeting adjourned. Thank you, everybody.
Thank you.
Thank you, everybody. Good night.
Night.
Thank you.